All right, so now we're going to do Down syndrome. So this is the most common chromosome disorder in live births and occurs about 1 in 800 live births. Most people can pick out somebody with Down syndrome in the general population, has very characteristic facial features, short stature, short hands with a single transverse palmar crease. So about 70% of people with Down syndrome will have a single palmar crease, but realize that is none of these are pathognomonic. It's the whole picture that goes together. About 10% of people in the general population will have a single palmar crease, and 1% will have bilateral single palmar creases. So I was told there's 280 people now enrolled, so we should have 28 people with at least one single palmar crease and 2.8 people with bilateral single palmar creases in here. But realize when you look at, and everybody's got to look at their hands. Take a moment. Okay. But realize whenever you look at somebody and you think they may have Down syndrome, if they don't have a single palmar crease, that's okay. 70% will, which means 30% won't. It really just tells you how much you moved in utero. About half will have a congenital heart defect. 12% will have a duodenal atresia. Less than 1% risk of leukemia, but still elevated over the general population risk, and the same with Hirschsprung's disease. Less than 1%, but elevated over the general population. And mental retardation that is variable, we usually say mild to moderate, so usually in the 40 to 60 range, but can range anywhere from 20 to 70. So the most common way that people have Down syndrome is to have a free trisomy 21, and that's in 95% of people. And you have a 47 count with that. So rather than having just one 21, then now you have 1, 2, 3 countable 21s. 4% are due to Robertsonian translocation. So one of the parents actually has a 45 count. They have a 21 and say a 14 hooked together. So they have movable living room furniture. They just put a sectional couch together. Whenever they have a child, however, when they give that 14 and 21 combines with the other parent's 21, and if they've given another 21 that was a free, the child actually has a 46 count, but still has an extra 21. Instead of this being free here, now it's just hooked on to a number 14 usually. So you still have three copies of that 21, but now it's just hooked to something else. And 1 to 3% will have some form of mosaicism. So that way there are different cell lines that are there. So there's a free trisomy 21 and a normal count, or a balanced translocation and a normal cell count. For the free trisomy 21, the risk will increase with maternal age. So here are pictures of people with Down syndrome. They have very characteristic facial features. The middle of the face is depressed, and it's called mid-face hypoplasia. They can have epicanthic folds. They have an increased gap between the first and second toe. Like I said, I did my training in Houston. I think every baby born near a beach has this finding. But we look for it in babies with Down syndrome, and again, a picture of a single palmar crease. Most of the babies will also look like they have a big tongue, but it's not necessarily a big tongue. It's just the hypotonia that's there, and that the tongue is sort of protruding out. Again, sort of that hypotonic face, very flat mid-face, a short, small head from front to back, and then the brush field spots. If you have a nice light-colored iris, you can see these pretty little spots around the outside of the iris. The ears are actually pretty classic too. This one has a nice squared off ear that's low set and small.